This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Regina League.
Well, hello, everyone, and welcome to another episode of the Good Neighbor Podcast, based here in South Charlotte. And I'm super excited to chat with Dr. Joel Beck today. He is a board-certified plastic surgeon and the owner of Beck Aesthetic Surgery. Hey, Dr. Beck, how are you?
Hey, Regina, how are you? Thank you for having me on your podcast today.
Well, I'm remembering, was it about a year ago when you opened your own surgical center?
Yes, it's been about a year ago. Actually, it was almost exactly a year ago.
Yeah, because I attended your ribbon cutting and my mouth dropped when I walked into that facility. It is stunning.
Thank you so much. And it's a beautiful place. It's something that I wanted to build for years and years. And I think that all of the different features that I wanted patients to feel when we brought to the South Charlotte market, and serenity, comfort, warmth, all of those go a long way when you get nervous to come in for a consultation or something else. So we've really tried to hit it right on the head as far as that.
Well, it's amazing, very sophisticated too. And I know you have state-of-the-art equipment, and your staff is truly amazing. So I have so many things to talk about, but why don't we start with what got you into this industry? How did you decide you wanted to be a plastic surgeon? A little bit about your background.
Yeah, so I'm from Southern California originally, and I remember my dad's a dentist growing up, and I used to go to dental conventions. And I remember one time I was walking down one of the aisles over at the convention center in Anaheim, and I stopped off over at it was a videotaped oral surgery that has some blood associated with it. And I thought it was just fascinating. And my mom's like, Joel, she's like, doesn't that gross you out or something like that? And I'm like, no, I think that's really cool. And that, I think, was the start of my interest in wanting to become a doctor.
How old were you then?
I was like 7 years old.
Oh, no way.
Yeah. And from that age, I mean, I've always kind of thought I wanted to be a doctor. And so that's what I kind of set my goals towards, and finally did that. And I went through a lot of training. I spent 7 years in training after medical school, and started a practice in Northern California in the Bay Area, which I built it out really nice. It was a real successful practice, but I was just kind of getting tired of being in the Bay Area and the congestion, just the cost of living and everything. So we decided to come out to North Carolina, where I had family. We moved my parents out here from Palm Desert. So we're all here now. And I'll tell you, it's been such an amazing journey. I'm so thankful for my wife, Heather, who supported me in this, because she's like, you're not getting any younger. We better do something pretty soon if you want to do it. Yeah, made it over here, and we started off in a small little office over in Matthews at the Matthews Medical Center, the Novant Medical Center. And we were there for like 5 years. And finally, took about 3 years of planning and building for this location. And so now we have a beautiful, larger clinic, med spa built into it. We have a ambulatory surgery center that has 2 rooms. It has overnight capabilities, 2 rooms with a large screen TVs and space for significant others or friends to spend the night with the patient. So, we're always focusing on patient experience, and safety. And one of the safety things from my standpoint on longer cases is to keep people overnight and have a nurse observe them overnight and take care of patients. So it's been a journey, but it's been a really rewarding journey.
Well, I noticed when I'm there, you have a separate entrance for that side of the business where you're taking care of the patients overnight. So I love that it's kind of over to the side. There's a lot of privacy then.
Yes, absolutely.
So I'm curious, I noticed you are board certified plastic surgeon. Tell me what that means exactly.
So a board certified plastic surgeon is it's different than a or board certified cosmetic surgeon. We have strict training. Usually it's a combination. Actually, it's changed over the years, but it used to be going through general surgery and then sometimes you would do a fellowship. So I did 3 years of general surgery. Then I did a fellowship in burns surgery research, and then craniofacial surgery, and then the official plastic surgery residency. So after residency, you have to take a written board exam. And then once you pass that, then you have to take an oral board exam. So, and then once you pass that, then you're considered board certified. And then you have to do maintenance of certification over the years and get re-board certified or maintain your certification. So that encompasses, you know, making sure you have a certain amount of continuing medical education units and going to conferences, taking tests online. So it's not like you just finish and then you're done. You constantly have to improve yourself, your experiences, your training. And so that's what board certification means.
I did not know there was a difference between a board certified plastic surgeon and a cosmetic surgeon.
Cosmetic surgeons, from what I understand, it could be a general surgeon, it could be an OBGYN, it could be an orthopedic surgeon, it could be a cardiovascular surgeon, it could be surgeons other than board certified plastic surgeons who then take courses in cosmetics and aesthetic surgery to then get a board certified cosmetic surgeon degree. So,
Okay.
and so how they do that, how long they have to do that, I'm not exactly sure, but it is definitely different than a board certified plastic surgeon.
Gotcha. So, what is your personal philosophy when it comes to working with your patients? I saw online you strive for natural looking results. So, what it talk to us about that?
Well, um, can you repeat that one more time? I'm sorry.
Yeah, I was just, what is your philosophy when it comes to working with your patients? Let's just say in that first consultation.
Yeah. So my philosophy is first off, I really think it's important as a physician more than anything else. And there's a lack of this, I think. And I think it's because of just the way medicine is these days. But I really think it's important to make a bond with the patient. I think it's important to listen to the patient and feel like and for them to feel like you're listening to them and that there's a back and forth discussion on what's why they're here, what they're looking to achieve, if I can take care of them, if they're a good candidate. So I think that having a real patient doctor relationship is important. And when I have consultations, they're not like 5 or 10 minute consultations. I mean, we spend typically about an hour for a consultation. Um, so that way we can learn about each other and there's no rush. So it's not like going to I don't know, it could be like a primary care doctor or it could be
Yeah.
insurance-based medicine where you have to get in and out in 6 minutes or 15 minutes. It's a totally different experience. So I think that my philosophy is being there for the patient and trying to come up with the right decisions based on where they are at their life at that moment with whatever medical issues they may have. So
Do you find that a lot of patients come in with unrealistic expectations?
I think some people do. I think that there's a lot of people who have really realistic expectations, and I think that's probably the majority of people,
Okay.
but I think that there are some people who maybe get caught up in Instagram or Twitter, or I mean, or something where social media basically, where they want to look a certain way when they already don't have any issues from a surgical standpoint. And when I say
Is it?
surgical standpoint, also it's I mean, we do a lot more than just surgeries here. So I mean, we have the whole med spa, we have a lot of non-surgery things. That's a lot of the trending stuff that we'll talk about, I suspect.
Yeah. Well, yeah, there are a lot of trends out there. So I imagine you have to kind of reel people in sometime. And, maybe do you say no sometimes?
Absolutely. Absolutely. And sometimes it's not a no, it's like you may be a good candidate. You may not be a good candidate today, but if we change these few things, then you may be a good candidate down the line. And that's one of the things that we've really tried to do in our office is kind of diversify and have offer more services, including weight loss. So I would consider us a center of excellence for weight management because we have medical management of weight loss. We have a surgeon, a bariatric surgeon who does gastric sleeves out of our facility. And then I do a lot of skin loss. So that, in essence, is like a center of excellence for weight loss. And so we really pride ourselves on that.
Yeah, with these new meds out there and people are losing tremendous amount of weight, uh, I'm sure there's been an uptick in people wanting to know what to do with all that extra skin.
Absolutely. Definitely.
What are your favorite procedures that you do?
I like to keep it broad. I like to do an assortment of procedures. I do everything from the face to the breast and body. I would say probably the thing I really love the most is working with doing facelifts. I just think that they're challenging, but I think that they're also one of the most rewarding things. And uh, performing a deep plane facelift with upper eyelid surgery, lower eyelid surgery, a brow lift, maybe fat transfer to the face, all of these things, neck lift. That's all what I love doing. I mean, I love doing breasts. I like doing tummy tucks, rhinoplasties. I mean, you name it. I love doing those things.
Yeah, and then you mentioned your med spa. I am one of the patients there, and you have a phenomenal team, great products. Talk a little bit about the med spa.
So this med spa is led by our esthetician. Her name's Marissa, and she's fantastic. We also have Heather Rippian, who is she's a leading nurse injector in the country, and she trains other offices and other trainers how to train other people. So she's traveling a lot doing that, but we really pride ourselves on having her and welcome her. And so she's all about safety. She's all about natural appearance. She's all about choosing the right candidates so we don't have any problems or the other patients don't have problems. We have Megan, Alexander, and she is heading the bioidentical hormone replacement aspect of the practice. We're going to be bringing on potentially peptides when we can. We have a whole assortment of medical skincare products, and we can do some of the best machines from radiofrequency microneedling to laser resurfacing. We just got this device called the Helix, which is the newest, latest, and greatest of the CO2 lasers that has different features on it that give a better result. I don't know. We just try to cover all of our bases. We also do hair restoration. So
Oh,
there's a number
wow.
of different things that we do in the med spa. But what Megan is doing with bringing the bioidentical hormones, the weight management side of things, is probably some of our newest services.
That's amazing. So for your male, the male listeners, what kind of procedures do you do for men?
I'd say that some of the most popular things for men, well, one is weight loss, bioidentical hormones, or hormone replacement therapy is very important and sought after. I would say that gynecomastia is one of those things that also affects men, and it's an embarrassing thing. And so that's basically where men develop breast tissue that affects their self-confidence and that they want that fixed. And there's different ways that we do that, but that's a very popular procedure here. We see it all the time. Liposuction and body contouring are some other things. And now we have different medical devices, and one of them is called Renuvion. And Renuvion is a device that we use in conjunction with liposuction to help tighten the skin. And so men really like that. And then, of course, they like their Botox, and they like their, some people like fillers and skincare and even microneedling, and especially for like acne scars, things like that. So men are beginning to turn the corner some, and we're there to try to help them out.
Well, I love that. So, Dr. Beck, you are a one busy man, and you and Heather. So, when you're not working and being a plastic surgeon, what do y'all like to do for fun?
Well, we love going out for fine food if we can. Love trying new restaurants and wine tasting and things like that. We also like playing golf, or quite honestly, a lot of time we just stay home and we spend time with our dogs and take them for walks and let them run around. And I mean, they're our little babies, so we have a great time with them. And then, so those are some of the things that we do together.
Yeah. What are name a couple of your favorite restaurants, especially South Charlotte ones?
Oh boy, let's see. I think that the usual places are like Via Roma is awesome. Porter's House is great. I love going to Little Mama's. I think those
We
are
are
good.
lucky. This area
Huh?
has exploded with fabulous restaurants.
Oh yeah, now with the Valentine Bowl, that's awesome. Going there, and I haven't seen a concert out there yet, but I've gone to the restaurants, the Roosters. I think that's a great place, and the Flower Child. So there's some great places around here.
Yeah. Well, I agree with you. Well, it has been a pleasure chatting, and I want to have you back so we can dive into some of the procedures and, really explain them, because I think there's a lot of, you do so much and we don't even know what they are. So that would be fun. Well, before I let you go, what are some of the trending procedures?
You know, I say that some of the trending things out there right now. First, I think people around here, especially like the real natural results. Not everybody, but people really like natural results. And rather than using some of these fillers that may give you potentially too much volume, that using like platelet-rich fibrin gel is one of the things that we have here that uses only your own blood, and we can divide it into platelet-rich fibrin, which is like growth factors, and create a gel out of the remaining part. And we mix them together, and we can actually add volume to your cheeks and around your eyes. I think the tear trough. So I think that's really worked well, and it also helps with the skin. Um, Minimally invasive procedures, things that reduce recovery time, like Brazilian butt lifts, but using potentially Sculptra, one of the products. And I know that Heather's really done well with that at our office. Avali is a cellulite treatment, which helps with like cellulite. And you could do that under local. And then I talked about that Renuvion, that skin tightening that we use in conjunction with liposuction. So if you have arms that are affecting you and you're just don't want to wear short sleeves coming up in the summertime, this is a procedure that would not only help remove fat, but tighten the skin, so potentially you won't have a loose skin problem. I would say fat grafting, combinate to the face, combining procedures. So especially with the advent of Ozempic, these weight loss drugs, tirzepatide. If you can combat some of the volume loss by adding your own fat, that may work. And sometimes we even combine that with other procedures like a broadband light treatment for like sun damage or brown spots or even little capillaries. And then I think that there is a trend now, especially it seems like, let's say an overdone Brazilian butt lift. Some people want to decrease the size of that. Some people really want that, but some people don't. So they're looking at that. I say that sometimes people want us to dissolve the fillers in their face because they may be too full. And again, that's something that either Megan or Heather can do.
I didn't know you could do that. I didn't know that.
It depends on the type of filler, but that you can do that if it's a hyaluronic acid filler, let's say Juvederm, or if it's Restylane products. Some people want us to either downsize or remove their implants altogether, breast implants.
Yeah.
And then I say the other thing that's really cool is that we institute three-dimensional technologies, like it's called Vectra or Visia. So if you come in to see the esthetician, she could put your face in basically a camera that takes a picture of your face, like a three-dimensional photo, and she can show you what it would look like if she were to treat you with medical grade skincare, or what it would look like if you didn't treat with medical grade skincare or all these other ancillary procedures. So that's something that gives the patient objective data on their progress with their treatments. And then I do a lot of the Vectra analysis for breast augmentation, breast lifts. You can even do it for breast reductions. And I use it a lot for like rhinoplasty. So if somebody comes in and wanting that, I can show them what their nose potentially can look like.
Yes, for us visual people, that's a game changer. That I didn't even think of that. So how about a facelift? Can you kind of do it that way as well?
I think you can. It's not going to be as accurate. There is some distortions on some of the things, but when you can do like a profile view of a nose, you really can, it's more accurate that way.
I love it. Love it. Great information. So tell our listeners where you're located and how to reach out to you guys.
So we are located right off the freeway, right off of Providence Road in South Charlotte. So really, it's right across the street from Waverly Shopping Center. It's not far from, it's right adjacent to the SCCU Bank on the west side of Providence. If you just look over as you're going south on Providence, you look over, you'll see the SCCU Bank and then a building behind it, and that's us. So we're literally like 30 seconds off the freeway.
Yeah, so it's in the rear section of Ray Farms, basically.
Yeah, it's like a north portion of Ray Farms. Yeah, exactly.
Gotcha. Well, Beck Aesthetic Surgery is you guys are amazing. Your reviews are fantastic. And like I said, your facility is like nothing I've ever seen. So you brought a little slice of California for sure when you designed your surgery center.
I appreciate that, and I appreciate you having me on the podcast today.
Absolutely.
Thank you for listening to the Good Neighbor Podcast. To nominate your favorite local businesses to be featured on the show, go to gnpsouthcharlotte.com. That's gnpsouthcharlotte.com. Or call 980-351-5719.